Hello, welcome to SNS Park. Let's hear and learn together. I'm Yawning. Today we are going to explain about a topic from physiology, a function of pharynx. Let's go into the topic. At the end of the class, you will be able to understand the function of pharynx and be able to play in the clinical situations and used for analytic purposes. Now we are going to see about the pharynx. The pharynx before starting of pharynx, it is of nasal cavity. The image you can understand is of nasal cavity. Next is of pharynx. In that three parts. Naso, which is of yellow color, and oro is of blue color, and hypo is of lavender color. In that, for differentiation, we have given here the colors. And then is of esophagus and before, that is of anterior to the esophagus and the pharynx, which is located as a trachea. And above that is a voice box, which is of larynx. The pharynx is a muscular tube that serves as a common pathway for the respiratory and also digestion system. In the main functions, we can say that the conduction of airway to the larynx, that's a voice box. Then conduction of food to the esophagus, and also the production of airway during the swallowing purposes. Next is of resonance of voice. It's divided into three parts. Already we know that, and each part has the specific functions. These are common functions described here. The nasopharynx, which lies between the nasal cavity, the key functions are which act as the airway passage, and next is helps in equalizing the pressure in the middle air through the eastern tubes, and which contains adenocytes, which are pharyngeal tonsils that produce an immune defense against the inhaled pathogens. And during swallowing, the food plates rises and close the nasopharynx to prevent the food from the entering the nose. And clinically, we can say that enlarged adenocytes in the children can cause mouth breathing and smoking and recurrent ear functions. So nurses should observe for the signs and educate the patients. Irritation is nothing but swallowing. Is a main medical term. It's an important functions in the pharynx, which is of swallowing. These are three stages. First stage, we can say that oral pharyngeal and of esophageal stage. The pharynx plays a major role in the pharyngeal stage. The first stage of formation of bowel, and second stage of swallowing, and third is of spine to the up to the esophagus. The common use of oropharynx lies between the oral cavity, and its of main important function is of passage of both air and food, and contains planted tonsils which traps the bacteria and viruses, and also it's help in propagating the bowels down during the swallowing process. The oropharynx is rich supplied with the sensory nerves, because of that which triggers the swallowing reflex. From this image, you can understand that from the first image, which is of larynx is also doing the important functions of air pressure control. And second image, it's preventing the aspirations. And third image, it's a ventilation purposes. When we are hearing, also the voice box generation, it's equilibriuming all the functions at the one time. Swallowing is coordinated by the swallowing center located in the medulla oblongata and pons. It involves multiple cranial nerves, which is mainly of 5, 7, 9, and 10, and also 12. When the bolus touches the pharynx, the reflexes is triggered and larynx rises, and epiglottis closes, and the bolus is pushed into the esophagus. In stroke patients or neurological disease condition, this reflex is impaired. Due to that, which leading to dysphagia and risk of aspiration and pneumonia. Nurses must perform bedside swallow tests before giving the oral feeds. Larynx is a voice box, which are already seen. These are the parts of larynx, where is a cartilage is present, and trachea and epiglottis, and where is located, and the false vocal cords. Tonsils and adenocytes are the lipoid tissue which is located in the pharynx, in the rings. And their main function is of immunological defense. They trap and destroy the bacteria and viruses and entering to the mouth and nose. They also produce antibacteria. We can say that recurrent tonsillitis or enlarged adenocytes are the common in children. So nurses must monitor the difficulty for swallowing if they have, and also ear pain or any breathing difficulty. So we have to prepare the patient for possible tonsillectomy. Laryngopharynx, and so can also say that hypopharynx is the lower part of pharynx which serves as a common pathway for the food to enter and air to enter the larynx. It also helps the final separation of food and air and propels the bolus into the esophagus. Problem in this area is of maybe cancer can cause a dysphagia condition. Nasopharynx is of air passage plus middle air pressures. In oropharynx, we can say the swallowing plus the immune defenses, and laryngopharynx of final food and air separation through overall we can say the respiration, productions, all the pharynx is doing this is functions. In nursing, always assesses sore throat, difficulty in swallowing, voice changes, or sign of aspiration. Reference. Thank you so much for watching Yasas. I hope this video helpful to you. Please like, share, and comment your doubts below. And subscribe for more simple nursing lectures video. Let's hear and learn together. Take care. See you in next video. Bye bye.